Good afternoon, everyone. Welcome to Jefferson County Health Department Board of Trustee meeting. This is April 30th, 2026. It is 4 p.m. I will now call the meeting to order. If we'd all stand for a pledge of allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, I'd like to have a moment of silence for Mr. Doug Dotson. He was a longtime employee and a past director for the Jefferson County Health Department. So please give us a moment. Thank you, folks. I know Mr. Deal, he actually worked under you for a while. Is there anything you'd like to share?
I'd just like to say that in all the years I've been in public health, first with the city of St. Louis, their public health department, then here in Jefferson County, and then my years here on the board, I've known Doug, worked with him. He was one of the most helpful folks I've ever had to deal with. Very smart, very cool dry sense of humor. He worked for the state health department when I met him in what they call their district office, which is in St. Louis City. When he retired there, he came to work here. For a period of time, he was the assistant director, then became the director. It's unfortunate, I think, that most of the public never meet or never know the folks who work for him every day in public health, trying to improve their health and safety. But I think we all know that that's the way things are, and Doug was certainly that way. Really dedicated person, and really sorry to hear what's happened. So, thanks, Tim.
No, thank you. Appreciate that, and I agree. I've known Doug a little while, not as long as you have, but he was quite the straightforward guy. Now we're going to go ahead and move forward, and we're going to do a roll call, so please, roll call.
Mr. Pig?
I am here.
Ms. Henry? Absent. Ms. Stidham? Absent. Mr. Deal?
Here.
Ms. Taylor?
Here.
We have established quorum, and for the record, Ms. Stidham and Ms. Henry are both on obligations of their work, and both, I believe, are in training, so they are both excused. I didn't warn either one of you. Would either one of you like to read the mission, vision, and purpose?
I'll read it.
Okay, thank you, Valerie.
Okay, our mission is to promote positive health outcomes through the delivery of foundational public health services. Our vision is a healthy Jefferson County. And our purpose of the Health Center, RSMO 205.050, the Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much, Valerie. Appreciate that.
Welcome.
At this time, we will have approval of the agenda. Does anybody want to make an approval of the agenda or make an amendment?
I move to approve the agenda as written.
And I second it.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome of guests. We have Teresa from the leader, so thank you. Next on our agenda is approval of the March 26, 2026 meeting minutes. We have a motion.
I move to approve the March 26th meeting minutes as written.
I second it.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is the approval of the March 2026 expenditures for $114,749.18.
I make a motion that we approve the March 2026 electronic payments.
I'll second.
We have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Any opposed? Motion carries. Next is the approval of the March 2026 electronic payments for $450,342.46. Do I have a motion?
I make a motion that we pre-approve the May 2026 electronic payments.
Second.
No, this is the March, I'm sorry.
Oh, March, I'm
This is
sorry.
the March electronic payments, not the pre-approved.
Oh, okay.
Okay.
So
Second that.
So the motion was to approve the March 2026
electronic.
electronic payments. We have a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Now is the pre-approval of the May 2026 electronic payments, and that estimated amount is $584,747.00.
Make a motion to pre-approve those May electronic payments. Sorry.
Oh, I second it.
There's only three of us, so I'm sorry. Having a first and second, is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? All right, motion carries. Mr. Sykes, you're up with your director's report.
Okay. First of all, I just want to say that our old building is now on Gov Deals for sale. So if anyone would like to bid on that, you can go to govdeals.com. There is a $5,000 deposit required by Gov Deals. This is their requirement when they have property.
And that's to bid.
That's so you can bid,
Right.
right. But it is refundable, or if you do win the bid, it'll go to apply to the building. It will be listed for 60 days total. I think it's already been on there for probably around 10 days or so. We've had a few hits. Typically, what happens with this type of a bid on property, you'll get a surge at the last minute. So not having anyone bidding on it right now is not uncommon. So we got that going, and thanks to Steve for doing a lot of legwork on that. I wanted to mention that, and I'm sure Melissa will have this on her report for next month, but we just, last Friday, we had the Missouri Regional Coalition meeting for the Mobile Healthcare Association. Reason I wanted to bring it up was it's just, we're seeing more and more meetings happening in this facility, and that makes me feel really good that we built this building and made this room the way we did. We're seeing more and more other, not just our own agency, but other agencies coming here and having meetings. So I think the purpose of this room is being fulfilled. So that's why I threw it on my report, but next month I'm sure Melissa will talk more about the conference itself. A little bit of a budget update. There's more update that came after I already had this printed. The budget now for the state is with the Senate, but I just read that it's out of the Senate now, and the House and the Senate have to work to get it finished by next Friday. They have to have it completed. I believe I have the right dates on that. The Senate reduced the budget from where the governor, the House raised it a little bit, but then the Senate reduced it back down. I don't know for sure where the health department, the state health department falls in with that. Originally, there was like 2.3 million that was gonna be removed. We heard it got put back in by the House. I don't know for sure where the Senate is on that. So stay tuned on that. Hopefully we'll know more by next week. something that came across to us last week. I think it was last week. We met with a representative from Senator Josh Hawley's office concerning RECA resources. That's the Radiation Exposure Compensation Act. And she met with us about what this is all about and why she wanted to talk to us. Basically, this was due to some of the radioactive waste related to the Manhattan Project during World War II. Some of that was disposed of in the St. Louis area. There's some areas there. RECA was more out west, but he got Missouri included. So there's 21 zip codes that if people lived in these zip codes or still live there and have certain types of cancer, they could be eligible for payments. And they wanted us to, provide information to our, because we could have some people here in our county that live there.
Are any of those zip codes in the county?
No, they're
Okay.
all St. Louis,
Okay.
northern St. Louis County, yeah, Weldon Springs area.
I'm sure that would be one of the first questions.
Yeah, but we could have people that
Sure.
did work there, live there when they grew up. So they wanted us to be part of that. And I told her that I would mention at this board meeting as well. So we'll have these setting out at both of our offices for people to get. And then finally, I want to give Brianne a chance to talk about our new website design that she's worked so hard on. It's not just a design, I guess it was a whole redo. Her and Megan put a lot of time on this, and she's going to go through it briefly with you. I don't know if that microphone's on.
This is going to be show and tell? Ooh.
Does my microphone work? Yes, perfect. Okay, so I'm gonna hold this, because I'm that person. Let's go ahead and look at the first main page here. We did redo the website. As Doug said, it's been 7 years since we've updated our website as a complete redesign. We're using a new system, partly for just upgrades, user experience, and then as well as working towards meeting the accessibility compliance states for WCAG 2.1. So this is our homepage. I'll have you kind of scroll down a little bit. Those sliders will change monthly, weekly, quarterly. However, when we have new things that we want to make sure that we promote or new program pieces that are out. So those will change regularly. And then as we keep sliding down, there's our fearless director. So our vision, our mission, obviously our executive director. Scrolling down a little bit more, we went ahead and put a really big area here, a good section for our most requested services based on the last year of our analytics for our previous site. These were the main things that folks looked for. So we wanted to make sure that was readily available and easily accessible. There on the left side, you'll see where it says recent news. That's just where our most recent blog posts and or press releases will be. And then that's just the little teaser section. If you scroll down a little bit more, you'll be able to see where it says read more news and things like that. So there's our lovely board. There's your photos. Let me scroll down a little bit more. So over here on the left side, under that more news, those are our upcoming events and meetings. So right now, there are just the board meetings that are listed on there. We might get to a point where maybe we put community events and stuff that we're a part of on there as well, but we haven't made that determination yet. And if folks click on the April one or the May one, it'll take them to the page and they have an ability to add it to their calendar, which is really nice. That's a new feature. So under the Board of Trustees, we have your guys' information there. And then if you click over to where it says Board Meeting Documents, this is where all of the board meeting documents are available for the public. So we have them available for download. They are organized by month, and they're basically the approved minutes or the meeting packets. We kept those separate, otherwise it wasn't gonna be a long thing to work towards. So anything currently that has been within the last 12 months is easily discoverable right here. And if we scroll down just a little bit more, actually, I apologize, can we scroll back up? There's a little search bar there. So if somebody is looking for October, if they just start typing in October, it'll pull those up for them. Again, we are only doing the last 12 months right here. If we scroll down a little bit more, it'll tell you, hey, are you looking for documents before 2026 that you can't find? You can find them in the archive drive. This is part of us meeting the compliance guidelines. So we will continue to work on that, but it's not that they're not there and they're not publicly available. They're just located in a different spot per the regulations for compliance. And then down at the bottom there, we have the current bid notices and previous bid notices. So if folks are looking for any of our current bids, which we don't currently have any, or if you click on the previous bid notices one, that'll take you to the former tabulation sheets or the summary pages. Okay, so if we can scroll back up, we changed our menu, the way that the menu is laid out. We tried to keep it simple and easy to navigate. So we changed the headers to get care, get services, safety topics, permits and records, data reports, things that were pretty easy for folks to hopefully have a better sense of where they were looking. So if you hover over the Get Care one, I'll show you one of the pages, health screenings and testing. So we list all of the different testings, different testing options we have and screening options, blood lead testing, STIs. We go through some of the information for our chronic disease screenings where you can find more information, our communicable disease testing, and then we also link out to other partners as well. So this is kind of what our typical pages look like. We don't have to scroll through all of the pages, but if we go back up over into Get Services and just kind of hover over that to show you, we have a lot more pages on this website so that it is easier to find. Prior, we had community health and adult brain injury, bike helmets, car seats, Project Lifesaver, and the smoothie bike were all in community health. And if you didn't know that's where it would be hard to navigate. So this is hopefully a lot easier for folks to know what they're looking for to be able to find it. Scrolling over to the health and safety topics, this is where we have more information versus actual services that we provide. This is more of the informative education that we want to give the community. And I also want to just highlight, since I am live and people can see this, food safety. If you scroll over that one and just hover, that's where you'll find information on cottage foods, the farmers markets, etc. Those are usually big things that we get a lot of questions about this time of year, so we try to make that easier to define as well. Permits and records is pretty much what you think. That's where you'll get the information on vital records, the Missouri Sunshine Request, if you have any questions on how to do that, voter registration, as well as if anyone is applying for a food program permit. And then let's go ahead and click on the data and reports page. This is where you'll find the rest of our information that is not under the main page. This is agency audits, annual reports, strategic plans. Again, we put the last 2 or 3 years in here. And again, I think if you scroll down a little bit, I can't remember which one it was on. I think it was on the, I don't know which one. There's another little disclaimer here that pops up when you're looking for something that's older than 2026 that takes you to that archive drive again. To keep up with compliance. And then this is something else that I know a lot of folks were looking at for a long time, the weekly respiratory reports, the monthly communicable disease reports. Those are all loaded here under the data and report section. So hopefully that's a little easier for folks to navigate to. And if you scroll back up to the top, the last thing I'm gonna show you guys is the How Do I page. I'm really excited about this page. It's kind of like the FAQ. If people don't know what they're looking for, they can come to the How Do I, and it pretty much breaks it down for everything that we have. So we broke it down into our clinical services, our community programs, and we have a specific tab just for restaurants and food permits because we do get lots of questions on that one. Clerical records, our mobile programs. And then we had a lot of helpful links. So the lead property screening form, the resource guide, applying for Medicaid, code enforcement, things that necessarily aren't maybe ours, but we get a lot of questions about it. We have somewhere on our website that we can direct folks. If you notice at the bottom of that, that is where the RECA, Rika, I don't know if it's, yeah. But you'll see that we've added that there too. And then we finally have some of our community partners, which include some of the folks that are tenants in our building, but then also folks that we work with regularly or have partnerships with. That is the website. Does anyone have any questions?
I have a few.
Okay.
Actually, I just want to say, great job.
Oh, thank you.
I knew I tasked you guys with that a year and a half ago, but the building got in the way. So is it up and running?
It is up and running.
So it's live now.
It is live.
So as a note to everybody, remember this is a new program, just been put in place. If you find something that you don't think is quite right, please contact us and let us know. Be polite about it.
Yeah, don't tell me, I
because
don't want to cry. No, I'm just kidding.
Well, look, it's going to happen because
Yeah, 100%.
It's a computer program. So other than that, I'm going to say great job. Anybody here have any questions or comments about it?
Thank you. Shout out to Megan Winkleman for helping.
Who keeps that up besides you? Or is it you?
It's me and Megan.
Megan?
Yeah, I think she kind of got pushed into the website world, but she's going to learn to love it. Also, the one thing I didn't mention too is over the very top left corner of it, there is an I am looking for. The search feature for this website is way more robust than our last one. So if folks don't want to take the time to look for something or they're not sure where to look, this feature is definitely updated. It's 7 years newer. So that's a really great feature too.
I know it's a large task. Really appreciate it. It looks really good. Thank you.
It was fun. It was good. I really like the way it turned out. So hopefully the community does too. Thank you.
Yeah, Brianne and Megan both spent a lot of time going around, talking with all the different sections of the health department, sitting down with their teams. How do you want your site to look? Trying to build it to make sure we're getting all the information. It's going to be a lot more user-friendly. I think anyone that uses this is going to get a good experience using it. It's a lot cleaner, which I think that broke Brianne's heart because she likes to have colorful flowers and everything, but this is a little bit cleaner to read. So we really appreciate her and Megan and the work they did on that. That's my report, unless you have any questions. Yeah.
Steve, going back to the bids on the building, do any of those come to us, or do they go to the website? Do we see those?
It's all on the website. It's just like an auction site. So
Can we see those or not?
there's not any bids to see right now. They haven't, no
I mean,
one.
once they come in?
Will we be able to see the bids on this one?
When bidders start bidding, there will be, they'll be able to see, you actually can watch it. It gets very active when something's popular, and it's kind of fun. So, but that probably won't happen until about a day or two before it closes, most likely.
Okay. Thanks.
Any other questions?
All right. Is there any questions from any of the trustees on any of the stuff that's inside on our other programs that are reported in? Nope, all right. So you guys are off the hook over there. Next is our public comments. There's nobody here for public comments, so we're gonna move right on to old business. There's no old business. New business. Number one, act on nominations for elections of board officers. Chair, vice chair, secretary, treasurer. The nominees will be accepted for each position, which shall will thereafter be voted on by the entire board of trustees. That'd be the three of us here now. Voter requires a simple majority, and thank God, because if it didn't, we wouldn't be able to do this.
But since we're missing two folks who currently are officers, do we want to table this? Do we know?
Hold on a second. I would interject from our attorney. We have to do it.
Okay. Do we know if they're interested in continuing?
I know Tammy probably is. I don't know if Amber is. You know, either way for me, you know, if you would like to take it over, you're more than welcome to take the chair if you want to. You can have it. You know, it's either way. If you want me to stay there, I'll stay there. Valerie, if you want to jump in and get into this and.
You can stay there.
Okay. Well, I mean, we have to have, I guess we have to have nominations. I mean, I don't know about Amber, but I don't, so.
Well, unless anyone has anything different to say, I would just say, let's keep the same slate we have now.
All right, so you're nominating Ms. Stidham for secretary.
Yes?
So I guess we have to do one at a time. Is there any other nominations? Not hearing any. Do I need to do a roll call vote on this? So it's a roll call vote, please, for keeping Ms. Stidham as the secretary and treasurer.
Mr. Pig?
Yes?
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Motion carries. Ms. Deal also made the recommendation to keep Ms. Henry as the vice chair. Is there any other nominations? Not hearing any. Roll call vote for that, please.
Mr. Pig?
Yes?
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Mr. Deal also made the motion to retain Mr. Pig as the chair. Is there any other nominations for that? Not hearing any. Roll call vote.
Mr. Pig?
I don't know. I'm thinking about it. Yes?
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Okay, well, thank you again. Like I said, it is both a chore and a blessing in some respects. Steve's been really excellent, so I appreciate all his hard work as with the rest of the group. They all do a great job, so it really makes my job much easier. All right, so now we're going to bring up,
Kristen.
yeah, I know who it is. I'm just giving that dramatic pause.
Oh,
Our chief financial officer, no, she's not chief, she's
comptroller.
comptroller. Okay, thank you. This is for the approval of the 2026 Jefferson County Health Center budget. This is a first quarter revision. So before we get into your explanation, we need at least a first motion to approve, then we can go forward for that. A first, a second, and then we'll have discussion on that, okay?
Okay, I'd like to make a motion on the 2026 budget first quarter revision draft to accept
We have a
that.
second?
I'll second.
All right, we have a first and a second. Please, Kristen, explain what's going on.
Okay, so we did our first quarter revision based upon actuals that happened and some carryovers from 2025.
We can't hear you.
I'm sorry.
Speak up. Get in the mic, yeah.
I'm going to be like Brian. Here we go.
There you go.
Okay.
You got to get closer. Enjoy it. Get closer to the mic.
It's fine. So we needed to we needed to revise the budget because we had some numbers that came in from the end of the year of 2025. Now we have the actuals of the carryovers for those. So that affected our Jefferson Foundation Program support carryover amount. We added a training funds for environmental, and we updated the TRT, which stands for the Right Time Initiative. We updated their amounts as well. We had some federal contracts that we increased their amounts because of the carryover, the Superfund led, and then we updated infrastructure FIG to their actual amounts remaining. Let's see, we increased some of the Medicare and Medicaid and private insurance, and it was based on first quarter activity. And the interest and investment income were reduced because we had a carryover fund in there, and we reduced it to the actual carryover fund amount. Then expenses, we increased the personnel costs. This is due to, let's see, go to my next page. It's due to the Superfund year one personnel cost carryover. We had infrastructure FIG base rates in there, but they were spent out in 25, so we needed to remove those. We updated the premiums for the health, dental, vision, and life, which reduced those costs. And we were able to add or open up 4 vacant positions for hiring. So that is what that includes. We increased contractual fees. This is based on the legal hourly fees increasing in May. We also, we reduced the remaining expense categories, It was just correcting like windstream, jot form, and some other little things here and there. It wasn't anything big. We also were able to add, I wrote it in here. We were able to add the renewal expense for the firewall in there as well. The other thing that I added to it is in the non-operating expenses, we added a little bit to the reserves for the fire protection proposal, which was for repairs to the Arnold building. And then we also added the projected expenses remaining for the new building, and that's just financed through the loan. And that is what I have.
All right, so I get to the bottom line. I believe the bottom line was, how much is this increased? Is that 196,000?
It actually decreased.
Oh, I'm sorry.
Yep.
Am I reading that the wrong way?
Yeah.
That was the revenue side, I'm sorry.
Yeah.
Okay,
So yeah, it decreased on both sides by 190,
Too much.
196,000.
okay, well, mine still shows it in black and not in parentheses around it, so I was presuming that was the other way. All right, so it's a decrease. All right, well, that's good.
Yeah.
All right. Tell me what your other
I'm sorry. Next time I'll put good or bad.
red was always, I like red, right?
Yeah, we don't do things in color though, do
I
we?
know, I'm sorry. Any other questions?
What do the expenditures for the Arnold office include?
They include,
Yeah, those broken down.
I do. I just got to get to it. I think I have it broke down. I don't work well with one hand. I just want to say that right now.
Is this for the repairs?
Okay, so in the drill down on the last page, the non-operating expenditures for Arnold, there's a crack fill and joint seals in the restriping of the parking lot, burglar alarm and fire alarm upgrade, and then the fire protection material and labor for the proposal to replace the backflow device. That's what's in there.
Okay, thank you.
All right, so we have a first and second to accept the revisions. Are there any other questions? Any other comments? Not hearing any, roll call vote, please.
Mr. Pig?
Yes.
Miss Henry? Miss Stidham? Mr. Deal?
Yes.
Miss Taylor?
Yes.
Thank you. Here, I thought you were wanting more money.
Nope.
Okay, next on our agenda, pardon me, is our first reading of the resolution of Jefferson County Health Center regarding disclosure of conflicts of interest pursuant to section 105.485. Is this a yearly? Okay. I'm like, sounds awful familiar. Can we have a first and second, please, for the reading?
This is the second reading? Is that
No,
right?
first reading.
Of
This is of the resolution for the disclosure of conflicts. The second reading is for the mosquito, which will be next.
Okay. Okay, so make a motion to approve the first reading of the
Okay.
disclosure of
Thank you.
conflict of interest
And a second?
policy.
Yes.
All right,
I
so
second.
now I'll go ahead and read this. So this is Jefferson County Health Center resolution regarding the disclosure of conflicts of interest pursuant to section 105.485 revised Missouri Code, and our resolution number is? Did we get one?
We didn't get a resolution down there. How's that work? Year. What would that come after these? It would come after the mosquito. Yeah. Yeah, do that.
So we can hold off on the until the adoption, next reading, okay, that's fine. So okay, no problem. I'm sorry I threw everybody a curveball. So I'll continue, whereas public officials and employees must be independent, impartial, and responsible to the people in order to effectuate the proper operation of the Jefferson County Health Center. And whereas government decisions and policy must be made in the proper channels of the government structure. Whereas no office within Jefferson County Health Center should be used for personal gain. Therefore, be it resolved by the Board of Trustees of Jefferson County Health Center that the following procedure for disclosure by certain officials and employees of private financialer, should be financial, I believe. Oh, I'm sorry, there's a typo. Needs a space in there. Financial or other interest in matters affecting the political subdivision be effective immediately. I will read number 1 because it's the most important, and I think direct to all. Everything else, all elected and appointed officials as well as employees of Jefferson County Health Center shall comply with conflict of interest status under Chapter 105 of the Missouri Revised Statute, as well as any other state law governing official conduct. I think that pretty well wraps it up. So we have a first and second on the first reading. Is there any discussion matter? Not hearing any, roll call, please.
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
All right, now we're going to get into the second reading and the second and final reading of the resolution authorizing Jefferson County Health Center to provide mosquito control services to the city of DeSoto, the city of Hillsborough, and the city of Kimmswick. And this is pursuant to an intergovernmental agreement and authorize the chairman to execute intergovernmental, boy, that's a hard one for me, intergovernmental agreement. Oof. All right. So my question, do I need to read each city individually and go through with the resolution? Because. You can just read the title of the resolution. Okay. All right. Let's see, here we go. This one is for DeSoto. And this is the intergovernmental agreement. So this is Board of Trustees, Jefferson County Health Center, resolution number
26-04-30-01.
All right. This resolution authorizing Jefferson County Health Center to provide mosquito control services to the city of DeSoto pursuant to an intergovernmental agreement. Do I have a first for the final approval?
Yes.
Motion to approve, please.
Motion to approve the resolution for the mosquito control for DeSoto.
Second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye, or sorry, roll call. Almost got away with it, didn't I?
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Scrolling, sorry. All right, this one will be for the city of Hillsborough. Board of Trustees, Jefferson County Health, Jefferson County Health Center, resolution number on this one.
26-04-30-02.
Resolution authorizing the Jefferson County Health Center to provide mosquito control services to the city of Hillsborough pursuant to an intergovernmental agreement. Do I have a first motion to approve?
Make a motion that we approve the resolution for mosquito control for City of Hillsborough.
Second.
Having a first and second for the second and final approval, is there any discussion points? Not hearing any, roll call, please.
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Motion carries. Or I should say resolution carries. I guess I could read the same one. The next one will be for the City of Kimmswick. Board of Trustees, Jefferson County Health Center, resolution number
26-04-30-03.
resolution authorizing the Jefferson County Health Center to provide mosquito control services to the City of Kimmswick pursuant to an intergovernmental agreement. Do I have a motion to approve?
I move to approve the agreement with City of Kimmswick.
I need a second.
I make a second.
Thank you. Having a first and second to approve the second and final reading. Is there any discussion on the matter? Not hearing any, roll call, please.
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
That was a little laborious, wasn't it? All right. Next is approval of the automated gate operator bids. I'm sorry?
Can I make one comment real quickly?
Absolutely.
I just wanted the public to be aware that we don't just provide control services to those municipalities. We also provide it throughout the unincorporated areas of the county.
Good point. All right. So I'm going to go ahead and probably do this in reverse order since it's a bid situation. Why don't you go ahead and give us what your recommendations are on the bid?
So
For the gate, this is for the automated security gate
closure, yeah.
closure, right?
Right, we did an RFP, we received 2 bids, we opened those at the last board meeting. Then Mr. Crawford took those bids, and do you all have the spreadsheet up there?
Yeah, it's on our,
Okay,
it's on our,
yeah.
no,
So
I
he,
got it.
like he always does, he thoroughly went through and analyzed the bids and what they showed. What we're seeing is Kodiak had the most complete bid, and it was also the lowest bid, but they provided us a lot more information. Steve did check with them, with both companies, but Kodiak came in at $15,770.06. Masters Communication was $37,504.85. So the most complete and lowest is Kodiak, so we are
right.
recommending we go with them.
So I'm looking for a motion to accept Mr. Sykes' recommendation to accept the Kodiak bid. Do I have a
So moved.
second?
I second it.
Is there any discussion on the matter?
Steve's here if you do have any questions.
Why were the bids so different?
Yeah. Like over twice.
So I could make some
Just the
opinionated
facts.
comments on that, but essentially, the bids were so different because one company bid completely off the RFP. They provided essentially a whole badge reading process for reading badges. The RFP didn't call that out. And we might have had discussions about doing that at one time, but we did not decide to go that route when we did the RFP.
All right.
Okay, that makes sense. So the lower bid does everything we want, right? Obviously.
We believe it does.
Okay, good.
Yeah, it'll have a punch code, but our vehicles will have a,
It's an RFID tag that'll be in the window or somewhere located on the vehicle, so when they approach, it'll recognize that, open the gate, and then it'll have a free egress, I guess, is what they call it, so that when you leave, it just opens. And then it's supposed to have what's called a Knox box switch, which allows the fire department who has a key to be able to access it to get in. So,
All right. Any other questions? So we have a first and second. No other questions? Roll call, please.
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Next on the new business is any CDC or FDA updates.
I have no updates at this time on those.
All right. Is there anybody wanting to entertain any topics for the next agenda? All right. Not hearing any, I think we have a closed session, do we? Oh, boy, I don't like that look. All right, need a motion to go into closed session, please.
Make a motion, we go into closed session.
A second.
And this will be pursuant to 610.021, confidential or privileged communications between the Board of Trustees of the Jefferson County Health Department or its representatives and its attorneys, and any records which are protected from disclosure by law. We have a first and second. I need a roll call, please.
Mr. Pig?
Yes.
Ms. Henry? Ms. Stidham? Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Before we leave, let me ask, is there going to be anything to report out? Okay, so we will not need to come back for a report